Recently, I attended Sunday church services at St. Mary's Ethiopian Orthodox Church in northern Ethiopia. I traveled there with the Population Council's country director in Ethiopia, Annabelle Aruka. The visit was part of a trip I made during which I saw firsthand the impact of our efforts to improve reproductive health and well-being. At St. Mary's, I learned about the church's effort to eliminate what the pastor called harmful traditional practices. These included child marriage, violence against women, and female genital cutting. Nearly 40% of Ethiopia's population are Orthodox Christians. That makes the church an influential source of information on topics such as HIV and AIDS, reproductive health, and gender equity. The priests at St. Mary's promote a social gospel. On the day I visited, that gospel included messages about HIV prevention and the importance of reducing child marriage. The Council and our partners have trained over 3,000 priests on the risk of early marriages and HIV infections. These priests have reached about 1.2 million members of their congregations.
It's been a real pleasure and honor to work with people that have such influence in the community and who have really made changes in this 2 years that we've been working in this project.
Later in my trip, I have the privilege of meeting with the Patriarch of the Ethiopian Orthodox Church, His Holiness Abune Paulus. One project we discussed was the Council's collaboration with church scholars to produce a development Bible that will link reproductive health and safe motherhood messages to the calendar used to guide church worship services. The Council is also collaborating with the Ministry of Youth and Sports to develop programs for Ethiopia's adolescents. In an Addis Ababa slum, Annabelle and I visited a council program that supports out-of-school girls. Many of the girls have migrated from homes in rural areas looking for continued schooling or to find work or to escape early marriage. These girls are considerably poorer than other adolescents in Ethiopia, and most of them survive working low-paying jobs as domestic workers. Working with the governments at the community level, the Council created girl-only spaces in community centers, schools, and rented houses, and we offered literacy classes, health checkups, and social support services.
This one is those who have never been to school, formal school.
When we began this project, there was widespread skepticism that our program would be able to reach these marginalized girls. To date, we've enrolled nearly 10,000 girls in these programs. In Amhara, I visited a meeting of married adolescents who were learning about HIV transmission. The Council's also developed projects to delay marriage. Amhara is one of the world's child marriage hotspots. Nearly half of all girls are married by age 15. Often young girls are betrothed to older men. These men increase the girls' risks of HIV infection because the men tend to be sexually experienced where the girls are not. This is one reason why the HIV epidemic, currently concentrated in urban areas, threatens to spread to rural areas where there is a weak, at times non-existent health infrastructure. Over 60,000 married and unmarried girls have taken part in the Council's programs. Nearby, men in Amhara gathered for their weekly meeting as part of a council project focused on married men. The men discussed male norms and ways to support women's reproductive health. The council began working in Ethiopia in 1993. The steady growth in our activities there led us to open an office in Addis Ababa in 2007. We've recruited an excellent staff. Because of our collaborations with local governments, NGOs, and the Orthodox Church, the Population Council is widely known. Our work is recognized among officials and donors for its positive, life-changing impact among poor, young, and underserved groups around the country.